next guest, Paul Spinks, is a registered paramedic and health advocate with a trauma counselling background. With 16 years' experience, Paul knows too well the risks he takes walking into danger every day to protect our fellow Australians. Paul, thank you for joining us on Weekend Edition. Now, you would have had to have witnessed a range of illnesses, accidents and tragedy. How have you been dealing with COVID-19 and the pandemic?
Yes, look, Janie, I guess from an ambulance perspective, I've been in the business for 16 years, so we've been walking into houses long before COVID-19 with people with all kinds of diseases, all kinds of viruses, all kind of various illnesses. So COVID-19 is just the new kid on the block, and it's reasonably business as usual for paramedics. We've got most of Australia running away from the virus, and we're running straight into the virus. We're coming to your home. So I guess in so many aspects, it's pretty well business as usual.
How do you yourself manage to avoid getting sick, maintaining a healthy immune system, and I guess just as importantly, maintaining strong mental health?
Yeah, look, universal precautions, I like to call them, or as the industry calls them. We always wear gloves. If we need to, we wear a mask or we don an apron. And then we've got our own immunity. So, I'm being a big advocate to look after my physical health and my mental health, have good nutrition. Immunity is just not granted. It's something you have to work on. It's something you have to build on. But I'm pretty well living proof after 16 years, and touch wood, I haven't caught anything from any patients yet. But if you look after yourself, if you use the basic universal precautions, wash your hands, that social distancing that we're talking about, then your body should do the rest. You should be pretty well protected from things like COVID-19 and a whole stack of other viruses that can invade us, like influenza, for example.
In your opinion, how vital is social distancing? I mean, we are seeing some really strict rules, not only in Australia, but right across the world.
Yeah, look, obviously it's really important. And again, I come back, if I use myself as an experience, if I use the police force, if I use my ambulance colleagues as an experience, if we can crawl into your homes with COVID-19, with HIV/AIDS, with hepatitis, with bacterial infections that are multi-resistant to most antibiotics on earth, if we can do our job reasonably thoroughly and come into people's homes and treat them and remain pretty well unaffected ourselves, then I think that's pretty good evidence to say to the people of Australia out there, if you do the same, if you social distance, if you wash your hands and do all the things that the government's asking of you, then we're going to get through this just fine. We just have to carry it through. And again, we use ourselves as examples to say, well, the frontline workers can do it. You just do it, and we'll all be okay.
Paul, in your opinion, what are the main concerns with this pandemic?
Probably the biggest one of all, Janie, is the mental health fallout. There's obviously the physical aspects of the virus, but the mental health fallout absolutely terrifies me. Long before COVID-19 came along, Australia doesn't do too well in the mental health stakes. Last year we prescribed 50 million prescriptions in the order of anti-anxiety and antidepressant medications just to get through the day. 1 in 2 of us facing a depressive illness in our lifetime. So long before COVID-19 came along, we didn't have too much in the tank. We didn't have too many reserves to look after our mental health. Now you throw in something like COVID-19, and we've lost our income, lost our jobs. We're stuck at home. We can't walk down the beach and get some nice air into our lungs. So we just don't have a whole lot in reserves. So I think the mental health fallout is a scary one, and I think we're going to see it unfold. And of course, once your mental health is affected, it has long-term ramifications. So hence the reason, if we can look after our mental health, and if we can have something in reserves, and we're hit up with something like this, we can negotiate our way through a little bit better. But mental health absolutely terrifies me.
Paul, you make some really important messages there and points. Thank you so much for your time. I wish I could talk longer, but we have run out of time. Paul Spinks, you take care and stay safe.
No problems. Thanks for allowing me to come on your show, Janie.